Yes, sir. Mayor, we are now on item 12C.
12C.
And I'll go ahead and introduce the item. The city solicited proposals for health plan administrative services under RFP 19P030 on February 12, 2019. 16 firms out of 396 that were notified obtained the RFP package. The city received 5 responses from Aetna, Cigna, Humana, Florida Healthcare, and HealthSmart that were opened on 21 March 2019. The staff recommends that the City Council approve the award of the contract subject to resolution of contract terms by the City Attorney and City Manager to Aetna to provide health plan administrative services. The projected annual cost of the ASO is an estimated $166,104.12. Ms. Jan Bush is here. Should you have any questions, along with Mr. Joe De Niro.
Good evening, ma'am. Firstly, do you have a presentation of any kind?
Yeah, just quickly, Mr. Mayor, council members, good evening. Joining me is Jan Bush, who helped us with the selection process. And I'd like for her to summarize the process we went through. She validated some of the financials, as well as working with Aetna in terms of, where we're going from here in regards to the plan design. So I'm going to let Jan speak to that.
Okay. Good evening. It's great to be here. Thank you for having me back again. Can you hear me okay? So in February, we released an RFP. We worked with staff and we worked with purchasing to put together a solicitation for the third-party administrator of your self-funded health plan. And as summarized here, it was sent out through the public procurement process. Once those were returned, we have a worksheet with several different components that we measure and score. So we put it out, and then we do a side-by-side analysis of Cigna and Aetna and Humana and Florida, the 5 proposers that were responsive to the RFP. So we looked at areas such as general administrative. We look at plan design. We look at the network. We look at formulary disruption for the prescription drug program. And we also look at all the costs. So the biggest cost of your self-funded plan is claims. So one of the areas, particularly with an entity that's subject to sunshine laws, we try to protect the integrity of their proprietary information. So we do not ask for specific discount information other than aggregate discount information. And then what we do is, after we present our summary to the evaluation committee that was comprised of 5 individuals, we ask them to score who they felt had the proposal that would potentially meet their needs. Following that, they were invited back for an interview, a presentation to the committee. And in the interim, we actually went on site. We actually had Amelia, your internal auditor, that joined us in that process, where we went with one of our analytics folks on site to Aetna, on site to Cigna. They were the 2 shortlisted proposals. And we validated claims. So we pulled a random sampling of claims to verify what the discounts were averaging in certain areas: hospitalizations, outpatient surgeries, physician services, et cetera, to come up with an aggregate discount. Because again, that is an important component, in addition to other things like wellness and cost containment strategies, and how do you negotiate different kinds of provisions for your providers. So following that, we brought the committee back together with the results of that validation process, where we went on site to the TPAs. And again, the purpose of doing it that way is so that we don't have any information that what would be proprietary that might preclude them from wanting to submit a proposal to the city of Titusville, because that information would become public. So that's a way that we as a firm have been successful to help our public sector clients be able to validate discount arrangements. And then we negotiate discount guarantees from there on both the pharmacy and the medical portions of the program. So the committee came back together, and we had the presentations. And following those presentations, the committees rescored, if you will, and the final decision recommendation was to pick Aetna as the third-party administrator to to begin the negotiations process with. So we will be getting a draft contract, working with the city attorney and staff and purchasing, et cetera, to make sure that all of the provisions that were agreed to as part of the solicitation process are included in the contract and bound. We have rate guarantees for 3 years, actually, so we kind of have a good idea of what's going to happen. And as a matter of fact, we had 5 years requested, so your administrative fees are going to be guaranteed. And Aetna came in with an administrative fee that was substantially lower than what you have in place today. Quite frankly, Cigna did an excellent job with their proposal as well. It was better than what is in place today, so they really were trying to be aggressive to retain your business, but the Aetna proposal was deemed to be more beneficial to the city to move forward with. So following your action tonight, we have the Aetna representative, Mike Driscoll, that just walked in, so he's going to hear what the action is, and following tonight, we'll be asking for a draft contract that we can start the negotiation process with. We're also going to be discussing the implementation timeline and getting all of the different pieces of implementation in place. It's a big plan, so we will be getting all of those different components in place, your banking arrangements and enrollment and interfaces with data, et cetera, as well as a discussion on a second plan that we've been having some dialogue with to bring a base plan along with the current plan as a potential option for October 1 of 2019. So with your action tonight, we will move forward with that. If we are not successful, then the alternative to that would be to not award from this and negotiate with your current third-party administrator.
Thank you very much. Any questions?
Wait a minute. I'll do that.
You were a little slow. Vice Mayor.
Got that.
No.
No, I just simply want to say it's promising and one you don't expect to hear when you hear things like both proposals are better than what we have today. And I think that's something I'd like everybody, involved with this to hear. Good for Cigna having a good proposal, better than what we have today, and then Aetna coming along and doing the same, even better. So that's just exciting. You never expect to hear in insurance and health insurance that it's better than what we've got. So that's just promising, and thank you for your work on that.
My pleasure.
Yes, Mr. Jordan. Member.
Okay, I just need to understand that I agree with what Deputy Mayor Diesel said, but was trying to understand as far as the benefits is concerned. Can you give me some differences in what the employees can be looking for this year versus last year?
Well, the plan design is to your discretion because they're administering your plan. So we had them do their proposals based on your current plan design, so the plan that you have in place today. It's contemplated that that plan would still be an option on October 1 of 2019.
Okay.
But in addition to that, that there might be a second option for employees to choose from going forward after.
At a reduced rate?
At a reduced rate with reduced benefits that would
Well, yeah.
that would correlate to those reduced rates.
Okay.
And to add to that, we're trying to get, right now, our family health care is, some of our employees can't afford it. So we're looking at trying to get a base plan that they can afford that would provide access to the health clinic as well as catastrophic coverage.
Okay. Thank you.
Okay, I'll open the public if there isn't anybody else. Wait, we got one more. I'm sorry, Member Stokel, I didn't look up. Yes, ma'am, please.
Thank you, thank you. All right, so I just wanted to clarify, thank you so much. I know how much work you put into this. So just to clarify, this amount and what we're approving is the admin fee. So to have them work on the plan design and to start going ahead with that.
Correct.
Correct.
Correct. Your claims are going to be your claims.
Okay,
So
so
that- those aren't guaranteed.
to that end, we never see two companies or produce their own plan designs and then us look at those, correct?
They have standard plan designs.
Okay.
And they have underwriting, and they're going to help with some of that underwriting assistance to say, this plan is worth this much of an
Okay.
estimated decrement to your claims cost.
Okay.
So they can pretty much administer anything. But since it's your plan, it's not fully insured. Now, had we been soliciting fully insured options,
Okay,
which really wouldn't make sense for a number of reasons. We didn't, and we talked about it, but it was something that really, at your size and with the
Okay.
clinic and some other components or, dynamics with your plan, it really didn't make sense. But, so they have standard plans, but I think it's pretty much your plan, and they'll work with us as a part of the team that will be looking at options, the most beneficial options, the most
Okay.
cost-effective options that we can put in play.
okay, perfect. I'm excited to see what you guys come up with. Thank you.
We're excited too. We're excited too.
Is that yours again, sir? Go ahead.
Now I understand better. I understand better what's about to happen here, but I'm kind of enticed. I know it's our plan, but certainly looking forward because they are the professionals when it comes down to these plans for us to see what kind of options they have. Because health insurance is just so expensive for sure. So if they've got some ideas, then hopefully we're going to be very open to trying to get the biggest bang for the buck for our employees for sure,
Absolutely.
right?
I think one of the things that was somewhat compelling to the group is the fact that Aetna and Caremark and CVS are all one and the same now. So they're looking at a whole new model of healthcare where those CVS stores become somewhat of an anchor and a healthcare provider. I think it's transformative and disruptive and a lot of different things, but it's one of those new and innovative options that might be out there down the road, maybe not on day one, but certainly strategically down the road.
Very good. Anything else, Joe? Okay. I'm going to open the public hearing. Clerk, are there any cards on this item?
No, sir.
And I'll close the public hearing. Any council discussion, further discussion? Okay. Take a motion.
Okay,
And,
Mr.
City Attorney, since this is somewhat complex, did you want to?
If you're inclined to approve the item, the recommended motion is to approve the award of a contract, subject to the resolution of the contract terms by the city attorney and city manager to Aetna to provide health plan administrative services.
That's what I was going to say.
I thought it was. I just want to let him have his.
I appreciate that. So I don't have to repeat that, right?
No,
Okay. I move for what the city manager just said.
no, city attorney.
City attorney, I'm sorry.
No, since it's a legal type situation.
No, I
don't wanna
agree.
put you on
I
the spot.
appreciate that.
Okay, we have a motion, and do I have a second?
Second.
A motion, a second, any further discussion? Is this, yeah, this is regular. All those in favor say yes.
Yes.
Any opposed, like sign, passes unanimously.